Welcome. Today we have Tracey Simpson, and she is a licensed professional counselor in Georgia. She's also a master's addiction counselor, and she's been credentialed since 2002. She has 16 years experience counseling youth, adults, families, and individuals at high risk and in the correction population. Currently, she provides services to individuals, families, couples, those in corrections, those with addiction disorders, and military families through both employment and through her private practice. And Tracey uses an eclectic approach that includes solution-focused therapy, motivational interviewing, cognitive behavioral therapy, and also person-centered. And so Tracey, we're so glad to have you here today. And I'm especially excited because you work in corrections and use telemental health. And I've spoken to a fair amount of clinicians who provide that service, and it's really neat to hear how telemental health really helps with getting inmates the service that they need. So if you could just share with us a little bit about what that work is like how does it technically happen, providing services to those in prisons through video conferencing?
Well, typically what happens, I work very close with the HSA, which is the nurse supervisor. And I also work with security, because security, the correctional officers in the jails, they have to bring me all the inmates. Mm-hmm. So what happens, like today, I have telemed on Tuesdays, Wednesdays, and on Thursdays. Mm-hmm. So on Monday, I get my list prepared. There's like a mental health task list. And on that list are I call them patients, are all the patients that I see. There are men and women. So there's a dual gender facility at all the facilities that I'm at now. So mm-hmm. I see the men and I see the women. I look up because we have electronic medical records. I look up all the patients. I find out if they have any documentation as far as anything from their hospitals, anything from the providers that they have received mental health treatment in the free world. And that is how they call it, the free world. Mm-hmm. So I look and see if they have any kind of documentation already in their chart from their free world provider. If not, then I also go to the intake screen. Now, intake screen is what the nurses will get once they come in from booking. Uh-huh. You're booked into the facility. That, the inmate usually is letting them know if they have any kind of mental health history, any kind of medical history, and any kind of drug history. So I mm-hmm. get that information as well. And I already print out my list that I am going to see 25 to 30 inmates the next day. So
wow, that's a lot of inmates to see in one day.
It is. And I also see other inmates at another facility. But that is what I see for telemed. So uh-huh. I'm already prepping my list. I'm making notes of everybody that I'm seeing. I'm just writing down like salient points about them.
And do you do that the day before?
I do that the day before.
Oh, okay. Yeah. And how long are the sessions? Because, wow, that's a lot of...
Well, I am very solution focused, and I usually do more motivational interviewing with them at that time. Uh-huh. I'm asking them information, gathering information, finding out, what they did on the outside, what kind of help are they expecting, and what are their needs. I'm also getting an idea what their symptomatology is right now. Of course, with the men, they're more kind of, I have to pull things from them. The women, they already come in. It seems like they're already talking and whatever, because when they come in, they're already crying and giving me a lot of emotions and all of that. The other thing I look at is I try to discern if it's substance induced as opposed to something that's organic. If they've used meth, which meth is very common in Georgia, certain areas of Georgia. If they use meth 30 days before they came in, or within the 30-day period that they actually were booked into jail, then I'm not going to even recommend any type of medication management.
Mm-hmm.
So that's something that I also look at when I am, when I'm meeting with them. Usually my encounter with them is anywhere from 15 to 30 minutes. So I am on the computer. I usually start my telemed at 10 o'clock. I usually don't end, or sometimes I'll have to take a break, have lunch, and then sign back on. So
Ah.
sometimes my telemed does not end until about, I start at 10. Sometimes my telemed doesn't end until about 2:30.
Oh, okay. All right. So it's not that many hours. You mean like 4.5 hours?
Correct.
Oh, okay. But you see, for about 4.5 hours, but you see a lot of people because
Right,
it's 15
right,
minutes to a
right.
half hour.
That's right. And it all depends,
Yeah.
like I said. And then I'm seeing those from the floor
Hmm.
that are that's in general population. And then I'm also seeing the ones that are on status. Status being they're either on suicide watch or they're on mental health observation.
Okay. All right. Yeah. So I assume you like VPN in to their system to be able to read
Yes,
to read their chart.
yes,
Okay. And
yes.
then
I
so you
do
review
well
their
too.
chart, take notes,
I do.
uh, so that when you actually have your session with them, and I assume that they have like a telehealth station, like a room for their telehealth services, and the inmate would be escorted in. They'll have their session with you, escorted out. Another inmate would be escorted in.
That's correct. It's just like a kind of like a production line.
Yeah.
Next, next,
Right.
and it's in medical. So I am seeing them in the medical exam room.
Okay. Yep. And then is there someone that lets you know who it is that you're seeing, or does the inmate themselves just introduce themselves?
Um, well, what typically happens, I usually have one officer that is the medical officer.
Mm-hmm.
And she will tell me, she'll let me know ahead of time, okay, Miss Simpson, this person is in lockdown. So we have to have two people, two officers to bring this person down. So
Okay.
I'll tell the officer, she tries to let me know what I'm dealing with. Or sometimes I'll ask her because I don't see everything in their charts. And I'm
Yeah.
saying, okay, if this person is in lockdown, what is their charge? Because I want to know beforehand. What am I dealing with? Is there
Yeah.
any aggressive behaviors that I need to know about? Are they going to be able to sit through this encounter with me?
Yeah.
So I try to ask her those questions before, especially if she tells me I have to have another officer.
Okay.
So
Yeah.
I try to get some information from her. The other thing is she brings 5 inmates down to me at a time. So
Okay.
she'll say, okay, I'm going to bring these 5, Miss Simpson. And then after that, and then after I finish with the men, then she'll start bringing me the women. Then she'll say, okay, you want to take a break? That's when I want to take my lunch break. And then I say, okay, I want to see the people that are on suicide watch and the people that are on mental health observation.
Okay. Yeah.
So we have
And
somewhat of a system.
do they ever use a telemedicine cart where they wheel the cart to the inmate's cell? Or
No.
is it they're always taken to the medical unit?
Yes,
I
they're
guess.
always taken to the medical exam room. The
Okay.
only time there is a change or I have to, um, I have to make some adjustments to my schedule for that day is
Hmm.
like, say, last week I had an inmate that he committed one of the 7 deadly sins, you know,
Hmm.
in the state of Georgia. That could be murder, rape,
Uh-huh.
um, aggravated assault, what have you. So he's in a different pod, and he required 2 officers. They didn't have 2 officers available, so I had to schedule him for this week. So he's on my schedule for tomorrow.
I see. Okay. Yeah. And is there like a care team where care coordination happens between, say, yourself and the physician or the nurse or?
Well, what happens is when I finish when I finish seeing everybody on the EMR, we have I have to put in orders as far as what needs to happen.
Hmm.
Like sometimes if there's not enough information in the chart, I have to request records, whether it's from the last hospitalization or it's from another jail or
Hmm.
it's from a provider that's in the free world. So I request records and I let that patient know that we are not going to prescribe any meds until we can get verification. So the nurse takes that off. The nurse supervisor, the HSA, takes that off. Now, sometimes what I'll do is if I see that there's already records in the chart, I'll go ahead and review it, and then I'll consult with the psychiatrist.
Oh, okay. And they've a psychiatrist that works for an agency or works for the prison itself?
He works for the same company
Oh, okay.
that I do. And
Yeah.
when I consult with him, I'll put everything in my encounter, everything in that evaluation that I'm doing. It's like a diagnostic interview. And so I put
Yeah.
everything in there. And,
Sure.
then he'll ask me, what do you see? Well, what do you think? And then I'll give him my impressions. Well, they used right before they were arrested. So I like to see what they're like in the next 3 weeks.
Yeah. Okay. Yeah. Sometimes I think I've heard before that telemental health and corrections sometimes cuts down on the abuse of going to see the therapist. Is there any, are you familiar with that, or am I not correct on that? So sometimes they see it as like a kind of a getaway,
Well, there's a lot of times there is secondary gain for them to just get out of the block or
Uh-huh.
get out of lockdown.
Yeah.
The oftentimes the patient will come to me thinking that they're going to get medication immediately.
Mm-hmm.
And then after I gather the information, I let them know we have to verify everything. So when they say, okay, well, aren't you going to be able to give me something? I'm really feeling this way and that way. And I said, okay. And you told me that you used meth right before you were arrested. I said, so you're withdrawing from the meth and we're still going to have to wait. I said, now I can give you some coping skills. I can give you a handout on anxiety, on depression, on this and on that. And I said, and you can, try to utilize that while you're in the dorm. I said, but, we're still going to wait and we have to verify.
I see. And have you provided services like on site also in corrections?
I do.
Oh, you do. You do both.
I do
Yeah.
both. Yes.
So how would you compare the two? What are the benefits and drawbacks of doing it virtually versus being there on the same location?
Well, I mean, for me, I work at 2 other facilities. I drive to one, and then I'm actually, I drive to 2, and then I'm on telemed 3 days a week. So then, but I still have to service the facility that I'm at. So I'm doing telemed at one facility. Then when I get off, then I'm seeing inmates at that facility, which is, having the officer bring the inmate down to me.
Uh-huh.
So what I would say is, like, today, I was able to actually go in the cells because I can go to the floor. I
Uh-huh.
can actually go to the dorm. I can actually see the inmates. I can look at their arms. I can look at their hygiene and actually see it with my own 2 eyes. I could see if they ate their food. I can talk to the officers and just kind of have that free reign of walking around. I can't see all of that, nor can I smell. I could see what they look like. I mean, they're sitting in front of me. I could see their body, so I could see if they're well groomed. I can see what their size, body type is. I can't always see the things that are close up. I can't see if they have a history of cutting. I can't see if they have cut the day
Okay.
before. I
Yeah.
can't see if
I don't know if you ever
alcohol.
I don't know if you ever do this, but I've done assessments a lot through video conferencing, and like I would ask people, right? Like, well, for me, I had an awesome camera. Where I was working, I had a camera that I could totally manipulate. I could do 360. I could zoom in, pan, tilt. But when you can't do that, you ever have them just, hold up their arms, hold up both arms just to show you stuff like that. That's one way of getting around that. I don't know if you ever tried that.
Yeah. Sometimes I do. I especially do that with women when I ask them, do they have a history of self-injurious behaviors? And they'll tell me yes, and I'll ask them, okay, well, when was the last time you cut? Let me see. But I'm just very mindful of time, and
Yeah.
so I think about that too. Like if I spend a lot of time with one patient, then I know that I have to kind of cut it short a little bit with the next patient
Yeah.
because I'm
Yeah.
looking at the time, and I'm also thinking.
So they have you on a tight time frame.
Yes and no. They would like for me to be finished by a certain time, but they don't. I mean, they know that they're giving me like 24, 25 people.
Right.
So,
Yeah. Yeah.
you know,
Yeah. So
and there's some that they know that it's going to take longer. The bottom line is that if I see everybody, they're happy about that. And then they also happy that all the documentation is done by a certain amount of time because it has to be done before I leave.
okay. Yeah, that's a lot of work.
Yes.
And you go to facilities that are in rural areas and they're kind of spread apart, correct?
Well, I don't know if you're familiar at all with Douglas. I mean, with Georgia, but
Yeah.
So I
lived there for 14 years.
All right. So you're very
a little
familiar.
familiar. Yeah.
Yes. So I don't live in Atlanta myself. I live in Douglasville, and Douglasville is about 30 minutes outside of Atlanta.
Yeah.
Well, I was fortunate enough to to gain employment because I used to be a military counselor where I traveled all around the world. And so I really, really wanted to stay at home. So I contracted with this company that as Douglas County Jail. And Douglas County Jail is 6 miles away from my home.
Yeah.
So I drive 6 miles to work, but I do telemed at Douglas County Jail in the morning, and then I see Douglas County inmates in the afternoon. And then, and that's at Floyd County Jail. And Floyd County Jail is in Rome, Georgia.
Oh, yeah, that's a little ways, right?
Yes. So I have never driven there. I mean, they know me because I've been doing this for 2 years. So they're like, hey, Tracey. So if I take vacations or whatever, okay, well, where'd you go? So we have become somewhat familiar because I've been doing it for 2 years.
Yeah, it's really cool, isn't it? How when I was doing assessments through video conferencing, sort of similar to what you're doing. At first I was like, gee, I don't know if I'm going to have the same kind of relationships with people.
Yes.
But it's pretty amazing that you do. Like people say, oh yeah, it's Tracey's on the screen. Tracey's here, even though you're there virtually. It's kind of neat.
I mean, they have become pretty familiar. They'll ask me about my holidays, my vacation. So
yeah. It's not like you're hiding out.
No. They pretty much know. I mean, they'll even call me on my they'll call me on my personal cell, which typically I'm not supposed to bring my phone inside. But since I've been there for a couple of years, they're like, well, I just bring my phone in because sometimes they'll call me and they'll ask me, well, Tracey, what did you mean by this? Or what did you mean by this order?
Okay.
So I do have my phone in the jail with me. Then I also drive to Carrollton County Jail or Carroll County Jail, and that's in Carrollton.
Okay. All right.
That is about a 50-minute drive from Douglasville.
Yeah. So what obstacles what obstacles has telehealth overcome for the correction facilities? How has it been helpful, and what have the drawbacks been, and how'd you kind of overcome them?
I think that for the company that I am employed with, the president of the company, this is how he has been able to get more contracts because he really pushes this telemental health. Because he's saying that, that they're going to there's this Floyd County Jail. He has this contract. We have this contract with Floyd County Jail that says they're going to get mental health 7 days a week. And so that's what he pushes. He pushes this telemental health with all of these correctional facilities. Yes, you may not be able to see the providers face to face, but we're going to be able to see all of the inmates or even more because of this telemental health.
Yeah, the availability and the efficiency.
Being able to see more, like the doctors, at Douglas County Jail, I'm there 4 days a week. Well, the doctors may come in maybe 1 day a week, but then the other 2 days they're on the telemed.
Yeah, and so that brings the question about effectiveness. Is it any less effective through telemental health?
Hmm. I really have not. I think like in our meetings when we talk about it, like the I would say the pushback has been mostly from the jail administrators.
Hmm.
Like the jail administrators will say, well, we got to have somebody come into the jail at least so many days a week. That
Yeah,
that
yeah.
so that is what
But
they're.
but it's not. But is it related to actually being effective with the inmates?
No, because even like for the medical doctors, I the officer will bring up everybody, and they're in this holding cell where everybody is sitting waiting to see the doctor. The men are on one side, the women are on the other, and the doctor's on the screen, and they're sitting on the table, the examining table, and they're sitting right there, and that's what I see. I'm on the screen, and the inmate will come in, and they're sitting on the exam table, and the officer or the nurse will push the camera, the TV, because it's a freestanding one. I'm on
Mhm.
my laptop, and they push it right in front, so it's I could see them very closely. I could
So
see
so
their hair and all of that.
so do you notice? Have you noticed any difference in effectiveness with the inmates using telemental health, or not?
No, the only thing is I think like a couple of them will say, well, where are you? Are you here? Do you even know anything about Rome? Do you know what it's like living here? So they'll ask me
Right.
questions like that.
Right. Yeah. Okay.
They'll want to know, well, do I have any resources? So what I have done, I have gone online and I have looked for resources in Rome and all the areas in Georgia and the metro
Yeah.
and rural areas of Georgia. Now I have like this resource book. And so
Yeah.
I use that for all of them. And for the different places, I go to Carrollton and I'll give them the resource book, and I'll give them different things that I have been able to find online. So that way
Yeah.
there's not an excuse.
Yeah. I see. Okay. Yep. That makes sense.
Mhm.
And I would think in terms of effectiveness, the inmates want their services. They want to be seen,
That's the important thing.
and it'd be really frustrating if they're having to wait to be seen when they need services,
Well,
right?
and like I said,
If they're not getting adequate services, right?
well, even with telemed, I mean, the nurses, if there's any kind of outlier when they come in to book in, they're gonna put that inmate on my list.
Hmm.
So basically, even if an inmate says, even if it's situational stress, if the
Hmm.
inmate says, this is my first time in jail, they're
Hmm.
putting that person on my list. So I pretty much see I see a lot of people in the jail,
Yeah.
just based on whatever the nurse picks up during booking.
Hmm.
If
Yeah.
there's any kind of red flag, they're going on my list.
Yeah. And what was it like for you to begin doing telemental health? Did you have concerns? How'd you overcome your concerns? What was helpful for you along the way?
Um, it's kind of funny that you asked me that because I just had my evaluation, and the person that hired me went out on early retirement because he had some medical issues. So he was very, very hands off. He just figured, well, you worked in a prison, you worked in a jail, you'll be fine. But even though when I worked in the prison and the jail, yeah, they did have telemental health, but I wasn't one of the providers using telemental health. It was only for the doctors.
Hmm.
It was not for the clinicians. So
Hmm.
I didn't have any experience. So when he told me I was going to be doing Bartow County, which is Cartersville, and Floyd County, Rome, um, I didn't have any instruction. I didn't have a laptop at the time, so I was wheeling this big freestanding computer from the medical exam room all the way back to my office. And then
Hmm.
I just had to learn by error.
Yeah.
And my first time doing it, I started at 12:30 and I didn't leave work until 7:30. So I did not like it.
Wow. Okay. Yeah.
It was, it was cumbersome because I had to move this machine around. I had to move the camera on top. I had to move that around so I could see things.
Hmm.
And it just seemed to take me forever to do the documentation. So I
Yeah,
said, this is the pits.
yeah, yeah. And then
So
you picked it up.
I picked it up. I mean, I picked it up, and then they start adding, a couple of more facilities. Now I am just really doing one, and that's Floyd County Jail. That's the only one that I have. It's 3 days a week, but they're the ones that part of their contract is they have mental health 7 days a week,
Yeah.
and they expect it no matter what.
Wow. Okay. Yep.
Yeah.
Yeah.
So
Yeah.
yeah, I've changed my schedule around to accommodate them. I used to do it in the afternoon. Now I do it in the morning. Um,
Hmm.
I mean, they're our clients. So um, I like I said, I work with them.
Yeah. Excellent. Yeah. And you're doing private practice also. And you provide telemental health for private practice?
Not yet. That's why I took the webinar.
No. Okay. Yeah. That's why you took my course.
Yes,
All right. So, but you sounds like, but it's in the plans for you.
it is. It is in the plans. My practice has only been in existence now for not quite 3 years. I've had to get on, all the panels, and
Hmm.
that took anywhere from 3 months to a year to get on these panels.
Yeah. Yeah. It takes a while.
Yeah, it does take a while. Um, I would love to do that. I've even thought about, well, once I once I start, telemental health in my practice, then I could look at maybe cutting back my hours and going part-time.
Oh, okay. Yep. Right.
Because right now I work Saturdays with my practice and I do evenings.
Oh, okay. Yeah, because you're busy all week with your,
Right.
yeah, with your employer.
The good thing is that my office, I drive 6 miles to the jail, and then the office park that my office is in, it's about 7 minutes away from the jail.
Ah, okay. Perfect.
Yes.
Nice. Excellent. Yeah. Okay. So we will have your information for people to reach out to you if they're looking for a clinician, especially in your specialty area in
Yes.
Georgia. And yeah, really appreciate all of your insight, Tracy. Is very helpful.
Oh, you're welcome. Thank you.
Yeah. Yeah. Thank you very much.
Okay.
All right.
Bye-bye.